I often get asked as a nurse practitioner with 34 years of infectious disease and leading this COVID pandemic response of why do kids need to get vaccinated? And I think the main thing is that kids do get serious COVID. So we've had more than 4 million children get COVID, and about 4,000 of them have had serious MISC, or the multi-inflammatory syndrome in children, which can cause severe heart problems and vasculitis, blood clots, strokes, and we've even had 36 American children die of MISC. We've had over 400 kids die of COVID disease. And so while it is true that children don't have severe COVID disease as much as the elderly or older individuals, they can and do get severe COVID. We see more hospitalizations than we do for children with influenza, almost double the number of deaths. The other reason is that kids can have the long COVID type symptoms too, where they just don't immunologically close down that infection. They have a little brain fog. They don't feel themselves. The other reason is that unless we get the high percentage of vaccination and coverage, then kids will get COVID. And we're starting to see that now, that the percent of people increasing for COVID disease is in children because the older individuals are vaccinated. That means that more severe variants that are coming are going to be impacting adolescents and young children. So lots of reasons why young children need to be vaccinated and why we need to be concerned about COVID in them. So then let's talk about the vaccines. One of the questions we'll hear is these vaccines were rushed. And I can tell you, having been at all of the advisory committee on immunization practices meetings and looking at the data, I'm very confident in them and recommending them to my family, my friends, my children and grandchildren someday, hopefully. It was speedy, and I would say it was a scientific wonder. I would say it was international collaboration and financial investment like we have never seen before. We also have the great fortune of having messenger RNA come on the scene for vaccines. Now, some people will say, well, these are new. Messenger RNA is not new. It's been around a science since the 90s. We've used it in stem cell transplants and other therapies. And messenger RNA is a common way that our cells talk to each other. So in this case, it's taking the spike protein from the SARS-CoV-2 virus and talking to your immune system, getting that immune system to recognize it and build antibodies. Well, even just that simple, normal process of recognizing germs and making protective antibodies somehow gets turned around in the anti-vaccine world and some of the myths that come up. The most common myth that I've been hearing around vaccine safety is, I don't really want to give it to my children because it may cause infertility. So where did that come from? It did not come from scientists. This vaccine has been looked at by OBGYNs and geneticists and various scientists. There's really no biological plausibility for immunizations against COVID to impact reproduction. And where it came from was there is a protein, one of the amino acids in the spike protein of the virus is very similar. It's called syncytin-1 to an amino acid in the placenta. But because one shared amino acid does not mean that they are the same and that you would develop antibodies. It's like saying you have the number 7 in your telephone number and I have the number 7, so we have the exact same phone number. It's just completely different. So no worries about infertility or long-lasting effect. If there's going to be an impact to children or individuals, it will be during the time of the vaccination or within 2 months after it. It's not going to long-term impact children's development or reproductive organs. This targets the immune system, not the reproductive system. And we're in good fortune in that these vaccines are remarkably effective. They worked in the studies to 100% of the children 12 years and over did not get COVID in the trial, as opposed to 16 in those who got placebo. So they work. they're effective, they're safe, and what they'll do is keep children out of the hospital and out of the intensive care. And I work at a children's hospital in Minnesota, and even right now, today, late in the pandemic, we have 2 children in our intensive care unit on ventilators with extremely severe COVID that I am not sure how they're going to do. One from the disease and one from MIS-C. So it's something that no family should have to go through. They work and they're safe. So what do we think about who should be immunized? At this point, it's everybody 12 and over who are susceptible and who are eligible for the vaccine. And then soon, probably even in the fall of 2021, we will have 5 and over. And then I would say even before the end of this year, 6 months and over. And why do we need to vaccinate young children? Again, this virus is changing in its transmissibility and in its severity. Whereas the first virus that came out, about one person who had it could infect 3 people. Then we went to the B117 that first emerged in UK. That was one person could infect 4 people. And now we're seeing a new variant that came out of India and then was mostly spreading throughout the UK. That is, one person can now infect 6 people. So it's increasing in its speed of transmissibility. And if we have a vulnerable population of young children, they will be the ones that will get this, and it can potentially be severe. So the best thing to do right now is to vaccinate children, vaccinate adolescents, anyone who's age eligible. The only people who cannot get vaccinated are those who have had a severe allergic reaction to a prior vaccine or one of the components. Everyone else, whether you've had a heart transplant or immune deficiency, or you're a healthy teenager playing sports, all of these children need to be vaccinated.